My name is Inge Soorn and I work at the Department of Biomedical Engineering at the UMCG. And my research focuses on two topics. One is non-viral gene delivery. There we really study the mechanism of non-viral gene delivery and also development of nanomedicine for treatment of brain diseases. Well, we came up with this idea just by accident because I met a clinician, Dr. Haveman, during a patient participation course. And there he mentioned a problem that he encounters in the clinic. And we decided to come up with an alternative solution for that. The aim is that we can improve wound healing after surgery by locally applying oxygen. And what they currently do is to apply the oxygen via a tube through the nose of the patient, but that's very uncomfortable. So what we're trying now is to leave behind an oxygen-releasing material after the surgery. Yeah, so that's why we have a third partner for the project, that's Dr. Both. And for this project we need really a chemist to synthesize the polymers that we need to make this compound that we can apply locally after surgery. Yeah, so the first aim is to make life more comfortable for the patient. Not only by preventing this tube through the nose, but also by preventing that they need to undergo surgery again in case of complications that occur because of this lack of oxygen. But also we think that this material can be applied during other surgical procedures to improve wound healing. Thank you very much. On behalf of the team, thank you.
I'm Kevin Damman. I'm a clinical cardiologist specialized in heart failure in the UMCG in Groningen. Yeah, so my specialty is patients with acute heart failure that are admitted with the symptoms and signs of fluid retention. Yeah, so the difficulty with these patients face is the amount of fluid retention, and we want to get rid of it as fast as possible. So one of the things we are considering is that the amount of sodium is a very well response variable. So if the response is poor, we will actually change the therapy and increase the intensity of the therapy to make sure these patients get rid of the fluid quickly and be out of the hospital quicker than they are at the moment. Actually given a lecture in the HTRIC meeting last year, and we actually met there, and after that we went into discussion, and Giovanni was saying, I might have a solution for your problem, and this is the way we came into contact and designed this PhD program to get at least this moving forward for the coming years.
My name is Giovanni Maglia and I'm a professor at the University of Groningen. So the background is to make a sensor that can actually measure nitrogen and perhaps even other molecules directly from urine. And my research in the lab is indeed kind of develop these sensors and integrating them in devices to actually do exactly the same.
Yeah, so the patient will be shorter in hospital and hopefully they will be easier up-titrated in therapies that are important to keep them out of the hospital as well.
So I want to congratulate you on getting the PhD award from HTRIC.
Right, thank you very much.
Thank you so much.
Thank you.
My name is Philip Elsinga. I'm professor in PET radiochemistry.
I'm Ben Veringa, professor of chemistry at the University of Groningen here. Yeah, with this PhD project, we hope to develop a new way, new methods to make tracers, that can be applied for imaging of tumors, And for that, we have discovered, a very fast method to click things together at the molecular scale. And so we developed a method, that you use light. Here is a photoreactor. You take components, they click together once you irradiate with light. And this opens up all kinds of new opportunities.
And this is a reactor which emits blue light. And using this blue light, we can very selectively and under very mild conditions produce PET tracers.
So we developed, in this joint effort, a unique new way to introduce these PET tracers. And HTRIC sponsors us with a PhD position, and this is absolutely great because that gives us the opportunity to hopefully bring it all the way to the clinic so that we can help the patients.
And what we want to achieve is a new PET tracer that can be used to both diagnose tumors but also can help in assessing therapies for patients.
So congratulations with the HTRIC PhD award.
Thank you very much.
Thank you so much.
My name is Tineke Willems. I'm one of the radiologists here in the department of the UMCG.
I'm Christopher Bertoglio. I am professor for computational mathematics at RUG.
Yeah, we have main clinical issues and I like to translate these in images. And one of these problems is to image reversible cardiac damage in the MR. In patients with the most common valvular disease in the Western is aortic stenosis. Patients will have complaints if there is heart failure due to this cardiac damage. So we would like to diagnose these patients in an earlier phase, especially in patients who doesn't have symptoms at all, to detect reversible cardiac damage. And one of the techniques is cycling during MR examination. And that gives some technical problems, or not problems, but some challenges, opportunities, and that's actually the connection and the base of this project.
So the idea is to analyze these images by integrating these very heterogeneous data sets into cardiovascular models. So you can create a digital twin or an avatar of your heart in the computer and then use that quantitative information to take decisions at the clinical level.
Yeah, we aim to achieve to start to implement this model in patient care.
Congratulations, you are one of the winners of the HTRIC Research Award.
Thank you very much.
Thank you.
Thank you.